I want to change gears just a little bit and talk about some of the physical impacts, some of the mental and emotional impacts. And we have Dr. John Balmes here, professor of medicine from UC San Francisco, and he's a professor of environmental sciences at UC Berkeley. And he can count way higher than me, I'm sure. He got a lot of degrees, and I appreciate you being here, doctor. And what I'd ask, if you could address at some point, tell us, what are the special health dangers of wildfires? I do a lot of residential fire cases, and I've done some other type of fire, a lot of explosions. But what's unique about what happened here? And so, welcome, Dr. John Balmes. Thank you.
I agreed to come up here to speak to you because I really feel bad for you, and I'm sorry for your losses, and whatever I can do to help you understand health-related issues, I'm going to ask you to ask me questions after I give a short little spiel, because I'd rather respond to what you're concerned about than, give you a lecture. I do that all the time at Berkeley. I don't need to do another lecture. The reason the organizer asked me to come is, there are two reasons. One is I study the health effects of air pollution, and I also study wildland fire smoke in particular. I had a research project a number of years ago where I actually chased U.S. Forest Service hotshot crews around for a summer, measured their lung function at the start of the fire season, and then at the end of the season. Do you think it was the same? No. Did it go up? No, it went down. Yeah. It's hard to follow them over a long period of time because a lot of them are temporary or seasonal workers. There's actually increasing efforts to study wildland firefighters for long-term health effects because we don't know long-term health effects from wildland fire smoke very well. I'll tell you what we do know. So some of you have pre-existing health conditions. The two most important ones with regard to health changes, adverse effects from smoke exposure, are respiratory conditions like asthma or chronic obstructive pulmonary disease. Do you all know what I mean by COPD? And on the heart side, cardiovascular, people with coronary artery disease, people who have had a stroke, which is atherosclerosis of the blood vessels of the brain, and it might be in your neck, carotid artery narrowing. Individuals with pre-existing heart and lung disease are at the greatest risk from acute short-term effects from the fire smoke. Now we're past that period. Hopefully all of you did well. People with asthma in particular probably had exacerbations related to the fire smoke, at least in terms of needing to use their bronchodilator medication more or their inhaled steroid. You guys had some pretty high exposures up here. I was counseling people regularly in the Central Bay Area when the levels of fine particulate were 150, 160 micrograms per meter cubed. That's bad air quality. That's about 4 to 5 times what the US EPA limit is. But up here, it was 400, 500 or more. I have a good friend I work with who is an air pollution forecaster. He does he actually, I don't know how many of you went to the US EPA Air Now site to see how bad things were. He's the guy that actually, his company puts that up. It's Sonoma Technology, STI in Petaluma. And he told me how high things got up here. I'm sure that those of you who had to flee your homes because you were right in the way of the fire, had pretty heavy exposures. The fact that you're all you're here and listening to me is a good sign. Any of you, I'm not going to ask people to tell me about their health problems in public here, but anybody who wants to talk more about any health problems that they had right after the fires, I'm happy to listen. Long term, I said we don't know that much. Wildland fires, where it's just I shouldn't say just, forest and vegetation burning, it's mostly a respiratory health effect that we worry about. It's not as clear that wildland fire smoke itself has as much cardiovascular risk as diesel exhaust, for example. But we again don't know as much. There was a study of the big San Diego fires a number of years ago, and there were increased cardiovascular hospitalizations due to those fires. Enough fire smoke is going to make somebody sick with pre-existing heart disease, but it's more a respiratory problem with wildland fire smoke. But you all got exposed to structural fire smoke too, which is a different kettle of fish. There's a reason that structural firefighters wear self-contained breathing apparatus and wear tanks on their back when they're fighting, a single home or a single commercial building fire, because when synthetic materials like what you're sitting on, when they burn, all sorts of nasty chemicals or toxic chemicals are released. You're all on polyurethane foam cushions, and that's really nasty when it burns. Most of the smoke in the Bay Area was wood smoke. So I was counseling people not to be too concerned about that unless they had pre-existing heart or lung disease. Everything about environmental exposures really relates to dose, how much exposure there was. And hopefully, most of you got away from the really nasty structural fire smoke as soon as you could. Probably some of you had more smoke exposure than you would have liked, and you're worried about long-term effects like, am I going to get cancer? There's no question, I'm sure you've seen it in the either print media or broadcast or internet. Whenever we have fire smoke, there are carcinogens in the fire smoke. But I want to reassure you, an acute exposure, a short-term exposure, even if it's really high, even if you had smoke inhalation and had to go to the emergency room, you're not likely to get cancer from that, even though the smoke contains cancer. It's like smoking cigarettes. One cigarette, that's a pretty nasty inhalation, actually. You don't get cancer from one cigarette. The risk of lung cancer goes up after like 20 years of smoking a pack a day. That's the real inflection point. So I don't want you to worry that you're all going to get cancer because you were exposed to structural fire smoke. Can I say it was completely safe and you're never going to have any other long-term effects? No, I can't say that. We're still learning about long-term effects from the World Trade Center first responders. And there have been some cancers in those workers, but it's not like most firefighters end up getting cancer and they get exposed to a lot of smoke over many years. And I actually study structural firefighters in San Francisco. Well, I shouldn't say study. I cared for many structural firefighters in San Francisco because I'm at San Francisco General Hospital. And I've seen bad smoke inhalation, and most people recover very nicely from even bad smoke inhalation where they had to go to an emergency room. So I'm going to shut up in terms of my spiel, and I'd like to take some questions, which you might have. So I'll start in the front.
Most of the people that I know about were referred to using the N95 mask, and I know that isn't sufficient for toxics. So I researched in the P100, which is like a outer space mask. That's what I got. So what do you think?
Well, for the particulate smoke, the particulate part of smoke, the N95 is actually very good. So I was telling people in the Central Bay Area, where I said it was mostly wood smoke, because mostly what burned was forest and vegetation in terms of the total amount of combustion. So an N95 is very good for particles, and it's also good for going back into your home area with the ash. Now, you're right, it won't protect against gas exposure. So an N95 is, as you were, some of you fleeing the fire scene, there were gases as well as particles, and the N95 does nothing for gases. So you're right. The P100, which is more expensive, is better for gases, but hopefully most of the exposure after the initial fire scene is particles. The ash is particles. So an N95 will protect you. You should be wearing N95 when you're going back to your home covered in ash. You should also be wearing gloves and long sleeve clothes, because some of that ash is very irritating, and also eye covering as well. So a bunch of other questions. Just to try to get to everybody.
Are any universities doing studies on cleanses to rid the body of the metals and pollutants?
It's a good question. Yes, so the ash will contain metals. So it really depends on what burned, what metals are going to be there. Yeah. There are some ways to aid excretion of metals from the body, but you should be careful. There are a lot of kind of quacky approaches. Certain metals, like lead, can be chelated well, but there's not a lot of good medicines to rid the body of excess metals. A good diet and good hydration, sort of the best way to.
What do you think about chlorella or cilantro as far as removing heavy metals?
So I'm a physician, and I actually don't like to take medicines, but I'm totally fine with anything that's a healthy organic material, even if it's not scientifically proven to help, but it's not harmful, and there's folklore that it is helpful. I'm okay with that. I just don't want you to take anything that can harm you, and we don't know enough about a lot of things that people suggest in terms of their potential effects.
What do you think about chlorella and cilantro as far as removing
Well,
heavy metals?
I don't know anything about chlorella, but pardon?
The metal binds with the chlorella.
Yeah. So long as it doesn't have any toxicity,
No, there's no toxicity.
then I say fine. And yeah.
What about frequent sauna?
Well, frequent sauna, it can be nice for your mental state too. That will cause you to sweat, which will cause you to excrete metals in your sweat.
About the air filters
Yes.
in the car when you turn on.
Thank you for about.
Like a smoke shop.
Yeah. So the filtration is a way to deal with exposures, but it has to be the right kind of filtration. So there are air filters, air filtration units, standalone units. Some of them are good and some of them aren't. But the ones that have HEPA filters actually will reduce exposures to particles in your home. I have a friend or a colleague, he's in Delhi right now, and he was telling me that when the outdoor air is 200 micrograms per meter cubed, which is kind of what it was in the Bay Area, the fire week, he has 3 HEPA filtration units in his apartment in Delhi, and it gets down from 200 to 60. So HEPA filtration units will work. Your car doesn't have a HEPA filter. Many homes don't, but some do. So if you have an air conditioning system or a heating system with a HEPA filter, when you turn it on to recirculate, that will cut down particles in your home. If you smell stuff, when you turn on, if you turn on a ventilation system and you smell stuff, it, that suggests that you've got a problem with exposure. It's probably not a HEPA filter. But again, HEPA filters filter out particles. They don't do that anything for gases.
The Corps of Engineer wants to include driveways in this process. What kind of exposure can you get from a driveway that's been exposed to smoke? Can you
Wow.
wash it off, or are they being too careful?
I don't want to, go against the Corps of Engineers. It's out of my expertise about whether your driveway should be removed or not. I think it probably depends to some extent whether it's concrete or asphalt.
Concrete with pebbles on. I don't understand how they could absorb toxins, and if so, why can't you wash it off?
As I understand it, that's not the reason that they want to remove it. It's because the cement or whatever degrades with the heat of the fire.
But I have 100 foot of driveway, and I know only a little bit of it was touched. They're going to tear out the whole thing.
Yeah, I'm afraid that's outside my area of expertise. I wouldn't expect it to be particularly toxic. So,
I didn't know there was kind of magic stuff that gets soaked into it.
no, I don't think so. There was, yeah. I don't know who was next. Here, I'll come around.
If your house suffered smoke damage, how concerned should we be about toxins that are remaining in our environment at home?
That's an excellent question. And I'm involved with studying tobacco smoke residue on walls. It's called third-hand smoke now. I don't know how many of you have heard of that. It's an issue. Like I said, smoke has nasty stuff in it. I think the recommendation is to try to wash every surface as carefully as you can. I don't know what that means. I think if you can afford it or the insurance company will pay for it, getting a professional cleaner would be the way I would do it. I think that'd be safer and it probably would get done better. But that's a real issue. I think you should, especially if you smell, which I'm sure, if it smells, that means it's off-gassing from the walls and the furniture, if there's any, left. And so, yeah, you should thoroughly wash.
Doctor, we got time for one more question for you, and then we can have some afterwards and be fine. Thank you.
When the fire occurred, there's
Get to you.
thousands of microwaves and TVs and refrigerators, and we're very concerned that the particulates from those matters that contain various gases and chemicals have not gone to the upper atmosphere and are staying above Santa Rosa. I'd like you to comment on that.
You're certainly right. Electronic equipment, appliances, when they burn, nasty stuff is given off. I don't think those gases are in the environment above Santa Rosa or any other fire areas. The Mother Nature does pretty well in terms of blowing things away, diluting. I would be more worried what settles in the soil, and then that gets brought into the water table when there's a rain. That's not my area of expertise, but that I would be more concerned about soil contamination and eventually getting to the water, and I'm sure they're testing the water. I don't know how many people have personal wells versus public water systems. That's a big difference. But again, I don't think it's in the air we're breathing up here in Sonoma and Napa, but I would be concerned about soil.
Doctor, thank you very much. That is very helpful information. Dr. John Balmes.